Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the developmental dysplasia of the hip. Okay. Developmental dysplasia of the hip, if you see the statistics first. Okay. Developmental dysplasia of hip, the incidence is 1 in 1000 and it is more common in females. Males is to female ratio, if you see for the developmental dysplasia of hip, it is found to be 1:7. It is seen in bilateral condition in almost 20% of cases. It is more commonly associated with the left hip followed by the right hip. So most commonly developmental dysplasia of hip is seen in the left hip and it is seen mainly in the westerns more commonly than the Asian countries. Then if you see, there are 5 F's for the developmental dysplasia of the hip. So developmental dysplasia of hip is associated with female child, first born female child in the family. It is associated with female child, first born female child in the family, presence of the family history, and there is fair complexion, especially in western patients, and faulty intrauterine positions. So in developmental dysplasia of hip, we have female child, the child, it is associated with female child, first born female child of the family history present, fair complexion, especially in westerners, and faulty intrauterine position.
thank you and thank you for watching.